Thank you, everybody, and how nice to finish with evidence, and also some evidence around that in population oral health, it's important that we work with non-dental professionals. So this research is about some work that has been done with midwives. So as mentioned, I'm from Healthy Families, Healthy Smiles, which is a state government-funded initiative, and we sit in the Health Promotion Unit of Dental Health Services Victoria. I will be presenting also with my colleague, Shalika, and she is from the Population Oral Health Research Unit at DHSV. I'll do a bit of the background and then Shalika will give you the evaluation research findings. I just want to check, did anyone go to the innovation workshops yesterday? Did you hear the presentation around Peninsular Health? Good, well this is a background to that, so just think how the two work together. Also I'd like to acknowledge Dr. Georgia Jess, who is one of our partners in terms of this research. So oral health during pregnancy. The physiological changes that occur in pregnancy for women make them very susceptible to poor oral health. We know that about 40% of pregnant women have some sort of periodontal disease. Poor maternal health can also have negative impacts on the health outcomes for the mother and the baby. Although causality has not been fully established between periodontal disease and pregnancy outcomes, such as low birth weight and preterm birth, there is still sufficient evidence to suggest that an association could exist. What is more conclusive is that we know that mothers are the primary transmitters of carcinogenic bacteria to their infants. And despite pregnant women being at higher risk of poor oral health, less than 1/3 of pregnant women consult a dentist during pregnancy, even if a problem exists. Some reasons for this is competing priorities when you're pregnant. Also, there is a perception that it's unsafe to have dental treatment during pregnancy. There's also cost issues and lack of awareness around the eligibility of some women to be able to use the public dental service while pregnant. Oh, am I ahead of myself? Sorry. So we've done that. Sorry for that. Oral health in antenatal care. At present, oral health assessment is not part of routine antenatal care in Australia. Although the recent national clinical guidelines for antenatal care goes a little bit of a way, but not far enough. It kind of recommends that health professionals advise a pregnant woman to go and see a dentist. Currently, there is little education or training offered to midwives in their postgraduate training or undergraduate training about the links between oral health and pregnancy. Referral pathways between antenatal care service providers and the public dental service is rather ad hoc. So how is DHSV addressing the problem? Oral health assessment, A majority of the public sector antenatal care in Victoria is done by midwives, and they are well placed to conduct oral health assessment, promotion and dental referral during the first antenatal booking visit. DHSV has seen the New South Wales Midwifery initiated oral health education program as a first step in an Antenatal Oral Health Model of Care. This course provides an education opportunity to prepare Victorian midwives to be able to conduct an oral health assessment, as well as promote and refer the pregnant mother to a dentist if there is a need. The course that has been developed has the endorsement of the Australian College of Midwives, and when completed, a midwife gains 16 CPD points. More importantly, the course is very much evidence-based. DHSV has partnered with Dr. Georgia Jess from the University of Western Sydney to offer this course to a pilot number of midwives throughout Victoria. It gives them the opportunity to assess the appropriateness of this course for Victorian midwives. The New South Wales Education Program was modified slightly to suit Victoria's public dental policy of priority access for pregnant women or eligible pregnant women, which is not the case in New South Wales. So I'll hand over to my colleague Shalika to give you the findings.
Thank you, Gillian, and good afternoon, everyone. Now, I'll be taking you through the evaluation findings from this project. So the main aim of the evaluation is to test similar program in Victoria and understand the feasibility and acceptability of the program in Victoria, and also to determine the post-training changes in relation to knowledge and also in relation to the confidence to engage with the midwives and also with the young pregnant women. We recruited about 39 participants across Victoria, and data was collected using pre and post survey, which was administered online. So this slide here actually relates to the evaluation results, which are from 33 participants. And you can see that the blue graph here represents the pre-training status, and the red graph here reflects the post-training changes that occurred after the training. Post-training, in relation to knowledge in the field of oral health and pregnancy, there was a 20% increase in the knowledge relating to oral health and pregnancy. And similarly, the overall confidence to undertake oral health related tasks dramatically increased by about 50% compared to the pre-training level. Now, the midwives had relatively good knowledge about some of the oral health issues, particularly in terms of morning sickness and tooth erosion, and also beverage consumption and tooth decay. However, post-training, there was specific knowledge gain in particular areas, especially brushing soon after vomiting, and also cleaning infants' gum before the tooth erupted, and the physiological changes that occur during pregnancy and how it impacts on oral health. Now this slide gives you a snapshot of the improvement of the level of confidence midwives had post-training, and you can see that dramatic increase in the confidence level in terms of undertaking a mouth check among pregnant women, followed by midwives' confidence in explaining dental public policy and access to eligible pregnant women. Now, there was relatively moderate improvements in terms of incorporating oral health into the first antenatal booking session. Midwives thought that lack of time was a barrier in incorporating oral health related activities in the first antenatal booking session. Now, confidence to refer pregnant women to dental services remained very low even after post-training, which suggests that more work has to be done in this particular area. Now, the sections which are highlighted in blue actually provides us with opportunities to improve the referral pathways between public dental services and also antenatal care providers. It also gives us the opportunities to incorporate oral health related tasks into the existing model of care. Now, this is beautiful pictures of a few midwives who participated in the survey, and you also see Dr. Ajesh George from the University of Western Sydney. We also have Dr. Carol Gilmore from the Australian College of Midwives. So these midwives are holding their certificates, post-training certificates for this program. Now, the next two slides will take you through some of the perceptions of midwives on various aspects of this particular program. So you can see that we have provided a few quotes for you to gain an insight of midwives' perceptions. The most useful aspect of this particular training, midwives said that the gain in the knowledge, especially in relation to the physiological changes that occurs during pregnancy and its impact on oral health, and also the links between maternal oral health and child oral health and the infant oral health. Midwives also realize that they can play a very important role in health promotion, and also they thought that they are in a very unique position to incorporate oral health messages into their antenatal booking sessions. Now, midwives also commented that the knowledge gained through this particular training was relevant, applicable, and also appropriate to their practice. And some of them also said that they have started incorporating these messages into their practice, which is great, which is fantastic. A few more quotes here. All the midwives who participated in the training said that they enjoyed knowing oral health related issues where they didn't know before, and they would apply it into their practice and would also recommend to other midwives across Victoria. And the most important aspect is knowledge gain, and they thought that it was feasible to implement oral health related activities and tasks into their antenatal booking sessions. Now, I also remember, Martin, you spoke about behavior change in your presentation, and which is very true. And this is one of the best ways to change the behavior early in life. And one of your team also presented about one of the quote saying that I learned flossing and brushing when I'm 60. And then you take a step back and think that, is it not too late to start knowing about brushing and flossing? So I think antenatal care provides you with one of the best opportunities to inculcate good oral health practices and behavior early in life. And incorporating early good health practices can go a long way in life. So now I'll hand over to Gillian, who will take you through the next step and also the future direction.
Oh, right. So you've heard the very positive findings that came from the evaluation research that was done around the midwifery-initiated oral health education program. And this research finding provides us with a foundation for, I think, to build a very systematic approach to an antenatal oral health model of care. So at present, DHSV is expanding the opportunity for midwives to do the course. So up to 100 midwives are taking part in this training. And we hope from these 100 midwives to create a pool of competent midwives in oral health promotion and assessment. Secondly, Healthy Families, Healthy Smiles is facilitating the establishment of close relationships between antenatal care service providers and their local public dental service. And as you heard yesterday from the Peninsula Health model, e-referral model that's been used with midwives at Frankston Hospital. So all those midwives at Frankston Hospital will be doing this program. The other important point around an antenatal model of care for oral health concerns clinicians, our public dental clinicians, that you need to be very well aware of the dental clinical guidelines for the treatment of pregnant women, because it's important that the midwives have confidence that if they refer a pregnant woman to the public dental service, that the woman will get treated. So please go and look at those guidelines and know them by heart. Because if a non-dental practitioner refers, she or he needs to have confidence in that referral system. And last of all is working with the midwives who have done the course to kind of create a bottom-up approach to advocating to have oral health assessment included in their first antenatal booking visit guidelines. So thank you very much for holding out for the last presentation, I think.